Hi friends, I am Dr. Sri Durga. I am a pediatrician. So in this video, I will discuss with you about how to manage your child with fever. The main agenda about this video is how to overcome fever phobia. First, what is the meaning of phobia? Phobia means you have an unrealistic fear about something which is actually not fearful. So now you know what fever phobia is. So it is an exaggerated and unrealistic misconceptions of parents whose children have fever. Meaning the parents of children who have fever have lot of fear and lot of misconceptions about fever. So this is what makes them visit an emergency department or a pediatrician's office rather than the severity of the illness. So stay tuned to watch and overcome your phobia about fever. So let me discuss this in few parts. In the first part, I will discuss what fever is, how do you identify and what causes it. And in the next part, I will discuss about how to manage, right? So first, what is fever? Fever literally means a temperature more than 100.4. But why does this fever occur? The most common cause of fever is infection. Infection can be due to bacteria, virus, fungi, or protozoa, and it can occur in any part of the body, right from your brain to the respiratory system, your gastrointestinal system, or anywhere. So, what is fever? Fever is the body's reaction to your infection. It is actually an immune response. By increasing the body's temperature, the body is trying to fight and trying to eliminate the infection. So, it is not harmful that a child has fever. It is actually an immune response, so it is beneficial. So, how does this happen? Our body has some set temperature. So, this is called a thermostat. You would have seen in the heater or refrigerator, you can set a temperature. So, when you are without any infection, you have a set temperature which is said to be the normal temperature. Suppose your child or you have got some infection. This thermostat which behaves exactly like a heater or a refrigerator. This thermostat is kept at a higher temperature. So the body feels warm, and at a higher temperature, the body is better able to fight the infections. So, what are the harm? But when your temperature is high, the child starts feeling uncomfortable, and some kids can have body ache or vomiting. So, this is what makes the fever uncomfortable, and it is actually an indication that the child has got some infection. So it is this infection which you need to address and not the fever per se. This is point number one. So you need to focus on what is causing the fever rather than the fever per se. But why is this fear about fever? The misconception is many people believe that a high temperature can cause brain damage or seizure or maybe even death. And the emotions associated with the fever is what much worrying than the fever per se. Is it actually true? Yes, some children do have seizures or fits when they have fever. So this is called a febrile fits. This is very common in children younger than 5 years. Is this febrile seizure benign? Yeah, in most cases it is benign. We'll have a separate video on febrile fits on some other day. And as of now, it is going to be benign. And an aggressive management of fever does not reduce the occurrence of seizures. This is point number two. Okay. So, having said this, fever per se is not something worrying. It is the infection which you need to focus on. So, next comes the second part. How are you going to manage it? I am not saying how you are going to treat it, how you are going to manage it. So, what is the target of your treatment? One is to identify any serious infection in a febrile child. Second is to reduce the discomfort of the child if you rule out the serious infections. So, to point number one, to rule out serious infection, When do you need to visit a pediatrician's office? Immediately. A fever in a young infant, especially less than 3 months, it is an emergency. Be it any degree, whether your child is sick looking or fine, visit a pediatrician's office immediately. And children who are not taking feeds or intake appropriately like any other day, children who look very drowsy, who are finding difficult to breathe, who have lots of rashes in the body, whose legs and hands are very cold to touch, whose urine output is decreased. So these are all some signs that you need to visit the pediatrician's office or emergency department immediately. So this will help them identify whether your child has got a serious infection or it is just a common childhood illness. This is point number one. So once your pediatrician has ruled out that the child doesn't have any serious infection, then comes the second point. It is to make your child feel comfortable. The target of treating fever is not making a child with fever absolutely afebrile or absolutely normal temperature. This is not possible. Just you need to make your child feel comfortable. So this is your target. So how do you treat it? So I'll discuss both medical management as well as the non-medical management. Medical management, as on date, most of the guidelines have approved only two medicines. One is paracetamol or acetaminophen. Second one is the commonly called brufen. So the dosage, how frequently you need to give, all you need to discuss with your pediatrician before administering the drugs. And the more the dosage you give or more repeatedly you give beyond the dose recommended by your pediatrician, it is going to be toxic. So be very careful when you give any drug to your kid. And again, there is no role in combining both the medicines or alternating both the medicines. It has not been found to be useful. And I already told you, treating fever aggressively is not going to prevent the seizures. So your target is only to keep the child comfortable. There are other medical measures by which you can make the child feel comfortable. Good hydration, give the child adequate rest, and symptomatic treatment with home remedies or the drugs which your pediatrician prescribe. The third common question which every parent has is, does my child require antibiotics? So what are antibiotics? These are drugs against the bacteria. As I told earlier, there are many agents, virus, bacteria, fungi, protozoa, which can cause infection. Most common is virus. They don't need any treatment and mostly your immunity will take care. Here, your antibiotics are not going to work. So fever doesn't equate to starting an antibiotic. It is up to your pediatrician to decide based on the child's symptoms whether to start antibiotics or not. So never self-medicate or start antibiotics. So now I think with this information, your phobia or fear of fever would have come down, and you need to manage fever and not control fever to a normal temperature. And always visit a pediatrician's office whenever you find the red flags I have listed or whenever you suspect the child can have a serious infection. Thank you.